Well, happening now, DHEC is gearing up for a slight change to how they'll be allocating vaccine supply for each part of the state. They announced those changes during a board meeting in Columbia Thursday today, and our Jason Raven breaks it all down for us and tells us how much vaccine will be coming to the upstate.
These changes were mandated by legislation lawmakers passed last month. Now, the goal is to make sure that the underserved and rural parts of the state get their fair share of the vaccine. DHEC says it will now be using a regional per capita allocation model, but that model also considers certain vulnerability factors. That includes things like percent of population that are over 55, percent of minority population, percent of high-risk population, poverty rate and 2-week incidence rate, and the number of unvaccinated people.
Last two are the ones that are likely to change the quickest, and that which we need to be able to respond to quickly. And so they have a bit more weight in our model than all the other ones. All the rest of them are weighted equally.
Now, this is based on the 115,000 doses of the Pfizer and Moderna vaccines the state receives. The breakdown goes like this. The upstate will get more than 26,000 doses. The Midlands will get the most, close to 32,000. The PD will get 25,504 doses, and the Low Country will get about 30,000 doses of the COVID-19 vaccine.
The percent that is allocated for a region cannot vary any more than 5%. From the actual per capita allocation that's in a community.
Now, DHEC says the numbers don't include the Janssen, also known as the Johnson & Johnson vaccine, just yet, since the state is still receiving a small supply of those doses for the next couple of weeks. The hospitals will also begin receiving a base amount of vaccine starting next week. Health officials say future weeks will not be lower than that base amount.
Know what the baseline will be. They should always know that much. They can point to that baseline, which will mean this problem we've seen with canceling appointments should hopefully largely go away.
The state health officials say they'll be establishing care panels for each region. Now, this would be a regional advisory panel that would update DHEC and others on any gaps they're seeing. In Columbia, Jason Raven, 7 News.
DHEC says as of today, 1.3 million vaccines have been given out in South Carolina.